Welcome, everyone. I'm Katie Richardson, President of Clinician Relations for AngelMD, and I am here today with Jane Jung, who is going to talk to us about Remmie Health. This week is our direct-to-consumer pitch club, and we are excited to have Jane here to talk to us about Remmie as part of our Pitch Club extension series. Jane, go ahead, take it away.
Thank you, Katie. Thank you, everyone, for the opportunity. I am honored to be here. I'd like to share my screen, especially I'm again CEO and co-founder for Remmie Health. I'm here to help to present to you how Remmie is supporting and integrating a solution into ear, nose, and throat remote care. Well, a little bit about myself. I'm one of the parents who contributed to one of the 16 million episodes of ear infections. And we're solving a big pain point. After myself suffering through that, I realized with COVID, these ear, nose, and throat patients still have to see doctors in person for their ailments because conventional symptom examination is via a standard otoscope in office. And ear infections, as you all know, ear infections and hearing losses are one of the most common conditions impacting 70 million children and adults in the US. 60% of these conditions are chronic. We need professional advices in the patient's hand. Conventional and currently marketed cameras just don't cut it because they're isolated devices and don't provide support to any care providers or patients at home. In fact, it cuts off your phone and mobile devices away from the internet, so you cannot seek help over telemedicine while using these devices. And TidalCare incorporates some of that, but they don't have a telemedicine software services, which the telemedicine platforms can pick up and incorporate as a plug-in onto their existing platforms. And we provide all of that. We differ from all of these solutions by a lot more in terms of providing that solution suite, supporting an easy and straightforward patient journey. Our solution suite include a at-home monitor, a class 1 device that's no longer being used in the in-person setting in the patient in the office, but can be used in the patient's home, an app and a software development kit we call SDK to plug into any telemedicine infrastructure so that the symptoms captured by the patients can be streamed or uploaded for physicians' view easily. In the back end, we also build Remmie.ai, which is an analytics engine that takes the image and the text in terms of the description of the symptoms, classify them, and provide a feedback to support accurate diagnosis of these conditions. We currently are receiving revenue through the device sales from the patients, as well as the software license with the telemedicine platform. And for each new patient that we refer to these platforms, we also receive a commission for these calls. There's a patent pending. There are a couple patents on the AI diagnosis engine, and I would love to go into details in the discussion if you'd like to know more details. This is how an example of how our current software development kit works. And this is a partnership platform that's telemedicine software that physicians and patients are already using. So as you see here, patients can can request and sign up for a physician to see them in an urgent care settings, and they are able to incorporate Remmie monitor as a part of this platform, and the pair button is powered by the software development kit that we share with the telemedicine platform. And as soon as the physician or the patient clicks on the pair button, the video streaming of the symptoms from the eardrum will come up and the physicians can see it in real time. So this is kind of a live view of what the SDK is capable of. It's capable of counting the usage, connection to a Remmie device, as well as streaming a live view of the symptoms. Obviously, it can capture a snapshot of these images and allow upload and sharing easily. We have gained strong tractions. We have one pilot launch last year into Amazon and Shopify with our services, contracted services incorporated in our app. So CareClicks and My Telemedicine are our earliest partners. And we started driving towards more and more customers this year with a firm PO from QVC. So we're looking to launch at the end of June and early July on their platforms for quadrupling our customers within the next couple of months. And telemedicine platforms love our services, support, and integration to incorporate into their existing offerings. In fact, we have 4 more platforms with firm PO contracts or partnership that's ready to launch. Some of these are in different levels of collaborations, but they're very firm in terms of relationship with us. We have gone a long way reaching milestones and generating traction, especially in the product launch, the awards and partnership achievements, as well as funding aspects of the company growth. Since our foundation, we have obviously built the product out, launched a couple of times. This is our 3rd launch of our 2nd generation product. We have received FDA and CE mark listing, received customer feedback and redeveloped the product, relaunched it multiple times on our different platforms. In fact, this quarter, we also have our SDK launch as well. We received partnership support, as I mentioned. One of the notable ones is the QVC, where we will be airing and promoting to about 19 million audiences through their TV network by the end of the month. We're looking to have a bridge round of funding of 250K to support our launches so that we can reach 7,000 customers and 5 more partners by the end of the year, where we are ready to launch a much bigger round to support scaling up of a commercial efforts rapidly. And all of these logos represent firm customers in the pipeline, with not only in the pipeline, but the ones that's for Q3 and Q4 on are pipeline customers where decision makers are already brought on board. We really thank you for the time, for the attention that you gave me for this presentation. I love to hear anything from you, especially this community who are medical doctors. We'd love to hear your feedback. Please reach us for any questions, thoughts, comments. My email and social platforms are listed there. Thank you.
Very good, Jane. Thanks for being here this afternoon. This is really exciting. So as a pediatrician, a mom, and a telehealth provider, I look at this and it could be a game changer. Like, it's very exciting. Tell me a little bit about how your product is differentiated from existing broadly available cameras that you can buy on Amazon, and talk a little bit more about your IP as well.
Absolutely. Yeah, thank you. We do differentiate, like I mentioned in our first slide, where we did tried our best to build this as part of a smart home. So by that, I mean, this is connected to the internet and allows it to connect to your mobile devices. And the mobile devices that it's connected to can also go online, which means it enables kind of a true, think about a smart doorbell, for ear, nose, and throat symptoms. Click on the button, it's streaming straight to your phone, and you can share it however you want. Instead of just the isolated devices that blocks your internet connection, this really differs from that. And then I want to emphasize on the 3 things: the support that we provide, the care providers, the physicians love us. We work with them very closely, co-create the product, support the use of the product, as well as the patients who are at home. This is kind of a behavioral change from, seeing a doctor in person to being able to use the device at home. We really are, building every effort to make sure the user experience is easy, and also the integration with the telemedicine. So the 3 things, the support, the integration, as well as our current traction, really attest to our dedication and difference with the other products.
Yeah, and your IP, like I wonder about, what pieces and parts. I know you talked about your patents. So what pieces and parts of this are patentable, and talk a little bit more about that.
So we have utility patents supporting the hardware plus the mobile transmission of the imaging signal with the machine learning in the backend to analyze the data. So that's kind of a system level IP that's covered by our utility patent. The provisional patent specifically covers the algorithm, the Remmie.ai algorithm in terms of image augmentation, classification, and machine learning analytics that's providing support for diagnosis, increasing the accuracy of recognizing these symptoms.
Great. That'll be very exciting. I look forward to seeing your future generations too. You mentioned your traction.
Mm-hmm.
It's pretty amazing. I gotta say, I'm impressed by it. Tell me a little bit more about how the QVC relationship came about.
Yeah, so they actually are very selective. They hold big find initiative. It's called the Big Find. Every year they select very innovative new businesses to showcase their products on their TV network. And this year there were about 2,400 entries, and we were selected as a top 90 in the home innovation, home care category, which is also new on their channel. So they're very dedicated to supporting us throughout the whole process as a new entrepreneur to broadcast to their vast reach of about 19 million audiences on a daily basis. It's a huge win for us.
Yeah, that seems like an amazing opportunity. Very cool. And I love the fact that you're partnering with these telemedicine providers. That's brilliant. Tell me more about that. Talk more about how that's working out for you.
Yeah, so we started off, as I mentioned, selling these to direct individual customers. And they love the fact that we connect them. We not only allow them to see the symptoms themselves, but also connect them with a provider, who are contracted with us, who are partnered with us right away. So they can get a relief right away. They receive a prescription or answer of what they're looking at. They basically wanted to they feed back to us. They say, can you work with my telemedicine provider? Can you work with my physician who are providing my telemedicine services? So we reached out, and then we started realizing that there's a big gap, on these offerings, on these platforms. The more we talk to them, the more they say, we're eager to bring you on board to strengthen our services, our offering, because it cannot just be a video chat. It cannot be just face to face. We need to feel, we need to see, we need to touch, we need to do all of that. If anything that you can do to help us with that, it will be amazing. So, and also on top of that, they already have existing relationship with physicians, with patients, with payers, with institutes, with employers and governments. So that's a vast, important network that we could tap into through these partnerships. So we thought that that was a great opportunity. And the more we speak with them, the more the pipeline gets longer.
For sure. And my last question for you today, tell me how the AngelMD network can support you and Remmie Health.
Yeah, obviously you're a really important network and community that we would love to do two things. One is to obviously funding. At this point, because we're raising a bridge fund to support the launches, we would love to have your support. So if any of you who are interested in making this part of how you can better support the patients, we'd love to speak with you. And then the other part of it is clinical advisory. We need to have that strong support from physicians for this to be viable. We can't be just an isolated device that patients do whatever they want at home. We want this to support the patients, to support the clinicians, and we want it to be integrated. So with that, we can have traction. So we see this as a very important dialogue that we can have with you as clinicians that you can support in any way with your common thoughts, co-design, clinical pilot, case study, in any way that you'd like to chime in and speak with, from an advisor perspective, we'd love to speak with you. Thank you.
Great. Well, Jane, thank you so much again for being with us today. And we look forward to hearing more about how Remmie Health is doing in the future.
Thank you very much, Katie.